Next in line, Dr. John Roberts. From the moment I saw him for the first time in Reno, no, Orlando, Reno. I knew he was a cool guy, and he's doing the same. Him and Dr. Pandor, Shabir Pandor, they do the same work in UK, and they've been doing it for a lot longer than I have, and all respect to them for being here today. Thank you.
Okay, thank you very much. And I'm going to say, I just want to change the tone of things a little bit, because, you know, you get the death slot, don't you? The time when, oh my goodness, everyone's going to fall asleep, the lights are off. So, I'm going to challenge you, I'm going to challenge your senses. I want you to have fun, and in my own way, I was given a title, biological structural dental care. What the hell is that, hey? So it also means I can do anything I want. Now, with this in mind, I also set up a company with my good lady, Interior Health Design. What does that mean? It means everything and nothing. So hopefully I can take on a roller coaster of some new exciting things that I want you to be able to take home tomorrow and start to use in your dental practice, because I'm a wet-fingered dentist, 5 days a week, not like Bobby, 6 days a week. Do you know this man has a world record? Okay? This man has a world record. But you've got to ask him later over a beer. He'll only tell you when you have to buy the beer, and he'll tell you. Told you I'll get you free beer tonight. So, I believe what I'm offering is a style of healthcare for the whole dental team. I want it for the patients and their healing. I want it for your staff and their healing. I want healthy staff. I also want me as the dentist to be as healthy as I can, with energy, enthusiasm, and I want to lead by example. Brilliant, apart from weight loss. Sorry about that. So, and I want to show how all aspects of our dental care can be integrated into delivering wellness. That's what we're here for. We're here delivering wellness. To acknowledge that something as simple as I'm going to teach you today, but as incredibly complicated as I'm going to treat you today, all have their place in dentistry. We're not going to pick the easy bits and not do the difficult bits. They're all together. And to appreciate and illuminate my profession, the profession I love, as a caring, healing profession, but also to be part of an integrative team. Okay? We had the other lecture before about the chiropractor, the osteopath. We all work in isolation. And I do find dentists probably know more about other health practitioners and what they do than they know about what we do. And it's about time we shouted up and say, hey, we're not just about driving Porsches and having fancy holidays in faraway countries, but it is a matter of we've got to be here showing we really are. So, what I aim for you to do is to have skills you can take home with you that will cost nothing. How far can I take you outside what you were expecting to see and then bring you back in 45 minutes? So I've only got 175 slides. I believe in the impossible. So look at what we do as health practitioners to change everyone's lives for the better. And I believe we can change everyone's lives by what I'm going to teach you in the next 45, 50 minutes or so. Learn through experience, through thinking, through fun, through laughter, and make you remember why we are here. So, please, can you all just stand up? Oh, sorry. People hate the truth. Luckily, the truth doesn't care. And IAOMT, is show me your science. That's what it's about. Truth is usually scientific, but people don't believe in the truth. They tend to ignore it. So, equally, I don't want you to be doing this tomorrow, because is this true of everyone? And please, I'm going to give you all these slides, right? Give me a memory stick or give me an email and I'll bump them all to you, okay? I was fortunate enough to go to India. I saw a tiger, and I spent more time taking a picture of the tiger than then enjoying being in the moment with the tiger. You know, it's a lesson learned. And so I'm there taking pictures all the time. I've got this hoard of information, but enjoy the lecture, get some of the energy and see how we go. So tomorrow is a mystical line where 99% of what I'm going to do, which is why I'm sat at the back doing the lecture till half an hour before. So, I want you to experience something. It's going to be part of the lecture. Can everyone stand up, please? Just quickly. And, very quickly, put one hand in the air. Right? And then what I want you to do, I'm going to count to 10. But, I want you to breathe in. Don't want you to do that. And I want you to breathe out and hold your breath on the out. So, breathe out, and I'm going to count. And put your hand down when you have to take a breath. 100. 200, 300, 400, 500, 600, 700. Are we starting to struggle now? 800, 900, 1,000. So, we're all about falling. We're stressing ourselves. I'll come back to that in a few minutes. Just sit down again, okay? Right, I'm going to get you to think. There you go. There's a real scientific slide. And I'm going to talk about science of us injecting a chemical into a mouse's brain. What relevance has that had? I'll tie it up to 2 of the lectures we've had today. So thank you very much, guys. You've made my job just a little easier. There's a bit of fun in this. Okay? So we have NHS dentistry, semi-private and fully private. I'm going to compare you to a bottle of Coke. Okay, how far out the box can I take you? But I had to put this slide in. This is the truth, isn't it? Yeah? Yeah. Change is inevitable, but growth is optional. And that is fun, and it's also just a little bit challenging. And our profession isn't growing up at all. It is, they're denying growth, and I'm going to show you how. Right, do you remember this? As your dentist would recommend Viceroys, right? Now, we've had this stupidity in the UK the other week, still saying mercury fillings are safe. There is no hazard to health. So, there's 2 shocking things in this video. One, the main content, but the other one is what I used to look like with short hair and a little bit slimmer. So, if we can get the next, see if this actually works. So, how do you get this to play? I just want to. Oh, go back. I'm going to have no sound on there. Right. Okay. One thing I didn't check. We don't have any sound on the video. You got the video controls? Right, okay, I'm going to do this differently. I'm going to take this off and you're just going to have to watch it this way.
You have a microphone there.
Yeah, but it's not playing. It's not playing through the cassette because I'm on
It's playing on the
sound cord.
computer.
But it's not, no, there's no sound coming on my computer.
Uh-huh.
Because it's plugged into the HDMI. Don't worry, what I'm going to do is I'm going to do this. Because it really is worth seeing. Sorry guys, we're going to get it this way. My volume's up. Sorry.
Get the benefit of amalgam being long-lasting when it's in my mouth, but I still have questions about whether low-level mercury release over years is going to make us ill. Could the chief executive of the British Dental Association reassure me? Do you accept that mercury is a toxin?
Yes.
Do you accept that it goes into our bodies and it's released from amalgam fillings?
Well, there's no real evidence that mercury does cause any problems in that way.
The EC, their latest document says the largest source of mercury exposure for most people in developed countries is inhalation of mercury vapor from dental amalgam. But you're saying it can't get into the body?
Well, it says exposure to mercury vapor. And mercury vapor, whilst you're having fillings done, obviously there's mercury vapor around. What I'm saying to you is that the long-lasting, remaining residues of mercury aren't shown to be present in people's bodies.
Right, but the actual vapor coming off the mercury filling, are you saying the BDA situation is that can only happen when the filling is put in or the filling is removed?
Yeah.
So it can't happen when you brush, it can't happen when you chew.
That's right. Yeah, but I mean, you've got to look at the quantity involved here and the significance of it.
But you just told me it was zero.
Okay.
Was it
La
zero?
la 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 la.
Is it zero or not?
No, I'm not going to do this. If you're going to try and trap me, I'm not
I'm
going to.
not trapping you. You told me that there was no. You told me that there was no mercury vapour released from an amalgam filling.
No, I'm not doing this.
You're not doing what? Answering the questions that we told you we were going to ask you.
No, you didn't tell me you were going to do it that way.
Do what? What way? I told you it was going to be about amalgam fillings. That's what we're talking about. We're talking about the safety of amalgam fillings. And your answer is?
No, I'll answer your serious question if you're going to ask me.
That is a serious question. Okay, the question is, I was finding it hard to see why two important officials seem to want to play down the generally accepted fact that we get a constant low dose of mercury from our fillings. Surely that's the first step to understanding whether or not dental amalgam may cause harm. After some discussion, the chief executive of the BDA agreed to have another go at the question. Do you accept that mercury vapour is given off from your fillings?
Yes, in very, very small quantities.
Okay. Do you think that's harmful?
None of the studies that we've seen have shown any connection at all with any of the very, very tiny amounts of mercury vapour that come from amalgam fillings on any systemic condition.
Mainstream
It was
dentists.
worth watching that, wasn't it? Anyone want a copy of that, please?
Who did this?
That was done on national television. We have BBC and ITV, and it was on the. Oops, sorry.
BBC Panorama.
No, it was ITV. Sorry, it was ITV. Do you want me to do this? Okay. Right. So
That they're interviewing.
I'm going to have to. But it had Charlie Brown in as well. But he's far too good looking. I'm not going to do the same video as Charlie Brown. So, I like these things. A problem only becomes a problem when we choose to see it as a problem. Well, really, that's the attitude, isn't it? It's not a problem. Why should I worry? And because I like Pirates of the Caribbean, Captain Jack Sparrow said, the problem is not the problem. The problem is your attitude to the problem. Yeah? And that's where reality is really. To me, that is a huge problem for that person for the rest of their life. And I have been doing mercury fillings and all this kind of stuff for 25 plus years. I'd give that up because I see that as a bigger problem for that person's health than mercury fillings. Seriously. Because that problem will lead to mercury fillings. And I'm going to try and show you in the time I have how that affects that person's life for the rest of their life. And that's the reason why that child is tongue-tied. How many of us dental practitioners take ownership of that and that person's health? Bobby, that is so crucial. And I don't know where that slide's come from. I really don't. So, again, in a more adult. And how many of you see this as a problem? Worn incisal edges in a child. We love worn incisal edges in adults because we can do veneers and crowns. And we all say, oh, because you're stressed in life, you're doing this. Worn incisal edges are a sign that that person isn't sleeping at night. They're clenching their teeth, they're grinding their teeth to get their airway open, and all the things that a harmed airway will create. So I want to try and illustrate all these things. And so from that child, you end up with an adult with an occlusion like this. We don't see that as a problem. But that person will have a problem. I want to challenge you. When you breathe, you think it's all about oxygen. Rubbish. It's about carbon dioxide. Carbon dioxide is vital to all forms of life. And most of you in this room at the moment don't have enough carbon dioxide. You've got more than enough oxygen, but you don't have enough carbon dioxide. And how many of you knew carbon dioxide is an antioxidant? You can see I'm not going to get through it all. How many of you take your dental care, so if a mother is going to conceive, you're making sure she's not snoring, because if she snores, she deprives the fetus of valuable oxygen so they don't grow as well, which is why all the high Andes, all the high Himalaya people are small because they're brought under low oxygen tension. So if a mother snores, she's more likely to have small children. This is the research that's coming out there now. So this is preconception. You can take the amalgams out, wait 120 days as we've been told. Do they snore? Can you give them a better chance in life for the little one? Now, sorry, I'm going to do the same thing. Okay, we've just done a little bit of an exercise, haven't we? Yeah? So you were holding your breath for 10 seconds. Hold your breath with this person, okay? Okay, start holding your breath. How are you getting on? He's trying, isn't he? Wonder why he's sleeping alone. You holding your breath again? How are you getting on? Is he starting to breathe yet?
No.
Is he trying?
Yeah, he's trying.
He's trying. So what are you watching here? You're watching a man dying, aren't you? Every night. A little bit more. Okay, he's going to breathe again. You can all breathe, oh yeah, he hasn't died this time. And he's not going to die for the next 20 years. But is he overweight? Is he functioning well? And I'm going to say, if you took his mercury fillings out, is that man going to get better? Or is there something you can do with him to make him better? Now, snoring used to be funny, didn't it? I'm very good at putting things down and losing them. Snoring used to be funny, but it isn't anymore, really. Just wait for this. Can I have an extra minute for changing the slides? Come on, Mark. So, this is me, ever so quickly. I'm a Liverpudlian, father of 3 boys and a granddaughter, qualified at Leeds University in 1981. Hey man, you qualified after me. It's like, I'm feeling really old. Set up my own practice in Rochdale, and Bobby knows Rochdale. And I chose to go mercury-free in 1982, and then I left the health service completely, which is like your insurance. NHS dentistry, they pay you a rubbish amount, but you got tons of work and you do it for the rest of your life. So I gave up all my livelihood to say, right, I'm just going to do it my way and do it. And I was probably going to America come 1992, 1993, David Kennedy, all Ziff, Vimy, all of those people. Thank you very much, guys, for doing what you're doing. I dip in and out of it, but been doing this a long time. This is my great city. And have you heard of these things? The liver birds. They are a special species, and if you can see them, it means you're a special person. And there's Liverpool rising from the ashes, because it's not been such a good city. What else Liverpool has done? I'll show you in a minute. In the 90s, I did my homeopathy, magnesiology, cranial osteopathy. I started working with all these people. I ran a course in 2000 with people from 32 different countries about biocompatibility. Bobby was there. Shabir was there. It's nice to see these people having the faith in me. And the smoking tooth video, the one that David Kennedy's produced, that was filmed at this conference. So that's my little contribution to going further forwards. And this is me. You'll never walk alone. Liverpool Football Club, by far the best football club in the world. Okay, and only Liverpool could come back from 3 goals down at half time and win a football match. You've got to have that belief. It's in the man. Okay? And Star Wars, as my other things, do or do not. There is no try. Oh, I'm trying to do this. You've got to do it. You've got to say, oh, well, only on my adults I'm doing mercury-free, but the kids I'm still doing it because I get paid. So many of our colleagues, oh, well, I don't wear the mask because it makes me feel silly and I don't want to scare the patients. Why don't we wear a mask? It's only us we're killing. The patients are gratefully poisoning us. We're protecting the patients and killing ourselves. And yet we also have the guys who are charging a fortune to drill fillings out and not protecting themselves and their staff. If I see any dentist who's not protecting their staff, they're not doing the job properly. So dentists, when we see them, they buy one mask for themselves. Staff are indispensable. Okay, I want you to read this. You're going to have to read this quickly. Is that quickly enough? Yeah. And you know what? I still cannot read that out loud because it gets to me every single time. And I haven't let go fully. And I can talk about my lung, large intestine meridian, upper fours and fives, and lower sixes and sevens, being the teeth that the meridians are connected to. I can do all of that. But all of us, we have to practice letting go in our beliefs. And I want to challenge some of your beliefs now. It was also written by a man. Those things we need to give up. Would we all agree? And that's why I don't do cosmetic dentistry and anything like that anymore. Then I hate a patient belly aching about a shade being a little off, an edge not being quite right. Hate it. Hate it. Right. So we are Da Vinci dentists. Why? Because we have an insatiable, curious approach to life and an unrelenting quest for continuous learning. That's why we're here. We had a commitment to test the knowledge through experience, persistence, and unfortunately a willingness to learn from mistakes. The trouble is we don't want the dental boards to find out about it. But we've all learned by our mistakes. You can help me with this, it's Italian, isn't it? A continual refinement of the senses, sophistication, sight, and just live the experience, enjoy every day. Stefano, a willingness to embrace ambiguity, paradox, and uncertainty. Some of the things that I'm saying might not make sense, but just embrace it, go away and think about it. The development of a balance between science and art, logic and imagination, whole brain thinking. You know, talking about meridians is right-brained, left-handed. Talking about science and mercury and concentration is is left brain, right-handed. Just lose that filter between the two of them, just let the whole thing go. Cultivation of grace, ambidexterity, finesse, that should say finesse and poise. That's beer drinking tonight, guys. And then a recognition of an appreciation for the interconnectedness of all things. That's a bit lovey-dovey, but that's what it's about, isn't it? Why be as healthy as you can if you're as miserable as sin? So, you know, let's have everything. So we better get on to something. So what are we here for? This, or the Da Vinci man with toothache? That's my favourite slide, but there's someone talking about cranial osteopathy tomorrow. My favourite subject. Equally, us in Britain, we never do anything. We can't grow anything that's too small. We do things and we pinch things from everyone else, which caused the American Revolution. You know, we take your cotton and sell it back to you again. So basically, I've just pinched everyone else's lectures. So my acknowledgement, and certainly the first part, is Dr. Brian Palmer. Look him up, you can have all these slides. But also Weston Price, Harold Gelb, Larry Kotlow, Derek Mahoney. So many people, I have stood on their shoulders and I'm grateful for them and I want to acknowledge them. We all know that Weston Price's work, we've seen it, Nutrition and Physical Degeneration, fabulous book, one of the best books you can get. Has everyone read Nutrition and Physical Degeneration? Seriously, I can give you a website and you can download the book for free. Basically, this guy went around the world and saw all the primitive tribes, and he saw when they're not eating westernized food, living westernized lives, they had broad mouths, flat noses, and they just look healthy. And within 2 generations of moving into cities, they had crowded mouths, they had dental decay, and the women's hips narrowed, so they were having more birth defects and bent heads when the kids were being born. It really is the seminal book. The language is a bit 19th century, but it's a great book. And so, I see this as a huge problem for this person's health, and he doesn't have a mouth like those people. Why? So this is the person, I'm getting there, sort of, he's getting large, he's got a big neck, there's no surprise in the size of that. Now, I live near a main artery motorway in England, and 2 o'clock in the afternoon guarantees some big fat lorry driver falls asleep, takes his HGV across the lanes and closes the motorway. This is your typical lorry driver who has the sleep snore problem I've just shown you and isn't doing well. Is it our role as dental practitioners to take his amalgams out? Of course it is. But should we be getting him to breathe better and sleep better and be a better human being? So this is what Dr. Parker came up, and he was bringing out the connection of bottle feeding, excessive thumb sucking, that's me, dummy use, tongue tie, which we're going to come on to quite a bit, and how it relates to malocclusions. And those malocclusions in later life lead to sleep apnea, snoring. But what about the high blood pressure, the heart attacks, the strokes? And in kids, bedwetting. How many of you know if a young boy wets his bed, there's an elegant scientific study, put a brace in, develop the arch, get him to breathe better, he stops bedwetting in 3 to 4 months. And yet it's a social problem we don't talk about. So how many kids don't do sleepovers because they're too embarrassed to wet the bed? And you can correct it with braces. ADHD, yeah. All these kids with problems. But what don't they do? They don't sleep. And they're in a Wi-Fi soup. And they're eating rubbish food. And then we wonder why we want them to perform the same. It's almost like putting diesel in a petrol car and expecting the car to work. It's not going to do. But how do we correct it? Through nutrition, lifestyle habits, sleeping, turn off the Wi-Fi, all of these things. And that's what we should be doing as dentists. I'm actually going to add to this because for me, with all of these things, it then leads to dental decay and gum disease. So we then start using fluoride, we then start using mercury, we start putting nickel-containing braces in. We're making them sicker because we never dealt with the tongue tie when they were a baby. We then take teeth out, so we compromise the airway even more. Take upper fours out, you reduce the size of the space in your mouth by 20 to 25%. Where's the tongue going to go? How many of you take 4 teeth out and make the tongue correspondingly smaller? No takers. So where's the tongue going to go when you bite together? Backwards. We create TMJ problems. In my country, it's easy. The TMJ problems aren't caused by the teeth. So again, it's not a problem because we don't want to look for it. Cranial distortions, wonderful lecture tomorrow, whole body distortion, and we're just abusing the person. This is all from a dentist, and I'm going to say all from correcting a tongue tie, which is where my passion is. So we want to educate the sleep apnea about breastfeeding. The old people who are snoring, you want to say, you've got these snoring problems. Perhaps if you were breastfed as a baby, you wouldn't have these problems. We want to say more people should be breastfeeding because if they don't and they have dummies, they're going to have sleep snore problems when they're older with all the corresponding things. This is the role of a dentist. Obstructive sleep. So here we go. Simple definition. Cessation of airflow for greater than 10 seconds with continued chest and abdominal effort. So you all held your breath for 10 seconds. And some of you will start to struggle. But you do that 5-10 times an hour for a night, your body changes. How many of you measure sleep snore problems? So none of you know whether your patients have it. Hook them up to a machine and you'll see people's oxygen levels go down to 82%. You'll see their pulse rate go up to 210. You only know if you see it. How do we know how much mercury is coming out of fillings? Because guys like this went out and measured it. Start integrating sleep into your practice because I'm going to show you it is hugely important. Probably keep your mouth closed, please. Thank you. What are the symptoms of OSA? Joe, can I have the tape, please? And the other things. Heavy snoring, stop breathing. And I'll tell you what, how many of my patients have come in saying, I don't even sleep in the same bedroom as my wife. I'm not asking, do you sleep in the same room as your partner? But it's a huge thing once you start talking to your patients about it. Excessive daytime, I'll get these right. This is the people who are crashing, and they reckon 60% of road traffic accidents are caused by sleepiness. High blood pressure. How many of you have patients on high blood pressure medication? And I'll show you why they're on this. Strokes, morning headaches, restless sleeps. With kids, do you ask the kids, do they snore? Do they sleep with their mouth open? Do they grind their teeth? Those kids have sleep problems that are going to translate to when they're adults. Hyperactivity and ADHD, developmental, bedwetting, poor concentration, the kids who fall asleep in class. We don't address them, but it's the dentist who can help fix them. Restless legs, nightmares, large tonsils. Breastfeeding is the biological norm. Bottle feeding is a deviation from the norm, and yet we accept it. We'll skip that one. But this is interesting. Study a relationship between disordered sleep, and I'm going to come back to this definition, cognitive and functional dementia. So all these people who are demented, we've got Alzheimer's, this increased epidemic, 60% had undiagnosed or untreated OSA. It's not the only thing, but if you think of a kid playing Nintendo, you think of an old lady in the nursing home. It's exactly the same. They're not breathing properly. I'm going to try and pull it all together in the time I have. So let's talk about breastfeeding. But you never thought you'd be going there on a Mercury conference. A child is meant to be breastfed, and the nipple goes in, and there's a certain element that the whole thing works. They suck for 5 to 10 times, and then they breathe. So the body is designed to do it, and they're also designed to do it in this upright position, not lying down. Have you ever seen a child being fed by a bottle with dad? They hold them at vertical, and then they put the bottle in, and the child spends half their life not trying to drown. And so the anatomy is all there. You can have the slides, but it's worth learning about. This is the crucial slide. When you're at rest, and this is to all of you right this minute now, your tongue should be resting in the roof of your mouth with no pressure against the teeth. The cheek should be inert, and the teeth, if anything, should just be lightly touching or just apart. We're not taught what normal is these days. We are taught to make people as normal as they can, but we're not taught what normal is. So there is no force. Your teeth are where the lips, cheek, and tongue put them. If the lips, cheek, and tongue are out of sync, then your teeth aren't in the right place. And we as dentists usually take over and make things worse instead of better, with the consequences I'm trying to illustrate. When a child breastfeeds, the nipple goes in here, the tongue pushes against the roof of the mouth and actually expands and grows the roof of the mouth. That's why breastfed children, the pictures of the people from Weston Price's days, have broad mouths. You breastfeed, you grow the mouth. And the nose, instead of being long and pointy, is broad and flat, a better airway. So this is how we should be, and no abnormal forces against the teeth. We just expect teeth to be there. There's a reason why teeth are where they are. What happens when it goes wrong? And this is something that I got in trouble for. I was told not to do, so being the true Scouser, I found my way around it. I got a laser to actually try and do better dentistry, without the drill and everything. And then I heard of this guy called Larry Kotlow, look his website up, and I said, I've got this PDF, can I put my PDF on my website and teach me how to talk about tongue ties, because it's something I've been doing for 20 years. And he says, well, why not come over? So Shabir and I got on a plane, flew over to America, and we learned how to release tongue ties, and I'm going to go over this. Anyway, it then came back, my insurers wouldn't insure me because they said it was a medical treatment, not a dental treatment. But equally, I've got around all of that now, and I'm starting to do these again. But if I'm saying when a child breastfeeds, that's what grows the jaw, that's going to reduce their dental problems. If they're tongue-tied, and there's different categories of tongue-tie, you can read all of this, download all the stuff from Larry Kotlow, it's there. If a child is this, they're never going to breastfeed well. And if there's one thing I would just do over everything else, and that's play around with my laser, releasing tongue ties on babies. And then you go straight back to the mum, they breastfeed, the mum's in tears because it's not hurting, because it's a pleasure to feed her child. She makes the bond. The dad comes in and shakes my hand because, wow, my wife is now feeding my child without pain. You've got to see it. Please, you've got a laser, Go and learn about Larry Kotlow and start doing tongue ties. The most rewarding thing you can do. So there's different types of tongue ties. That's all I'm saying. There's also different types of lip ties. And I'm going to come to genetics in a minute. But when a child breastfeeds, the lip should flange, the breast should go in, and then that should make a seal so the tongue can do what it needs to do. If they have tight lips, like these, all the way through, I'm not treating the diastema or anything that may appear later on. If they can't flange, the lips curl under. These are the kids who get a lot of air. They're always colicky babies. So what the doctors do now, give them antacids. Antacids mean they don't absorb all the milk and everything, so the mum gives up and they give them bottle food, and they still get air on bottle food, and they're fed in the wrong way. Those slides are going to come. So if you can release a lip tie and or a tongue tie or both, you change that child for the rest of their life. It is a bit frightening treating 2, 3, 4-day-old babies, but if you're doing it for the right reasons and the convictions, then believe me, it's rewarding. So there's lip ties as well. And I'll leave that one. So, but then they have functional problems. And so many people have lisps and they don't speak properly. And we then take teeth out to accommodate their dysfunctional oral musculature rather than getting the muscles to work right. Put the teeth where they should be, and you know what? They're going to breathe better, they're going to sleep better. That's where the lecture's going. And so with kids who've got tongue ties, they can't latch, they can't stay on, they slide off, they have long feeds. Mum's feeding them 22 hours a day because they just can't get the mechanics right because the muscles aren't doing it. If they had a limp, they'd be at the physio doing all sorts of exercises to walk properly. These kids, they just cannot function properly. Fall asleep on the breast, they're chewing the nipples all the time, they're not thriving, and sometimes they can't even hold a dummy in their mouth. The mum has creased or blanched nipples, and I have to say, I've probably seen more nipples officially on my patients than anyone else. But, they have cracked and bruised and blistered nipples, bleeding nipples, all these things until you start getting into the breastfeeding fraternity, you know nothing about. But boy, is there Facebook sites outside talking about all these things. Doesn't really do it for me, but, when you hear about all these things and you can help these people, boy, that's as good as taking mercury fillings out. But I'm going to come more about that in a minute. And so these are the kind of things you can have: nutritional problems, GI problems, drooling, gagging, sleep apnea, changes in sleep, speech problems, and jaw growth. I mean, these are massive. And what do we do in my country? Take out teeth, pull everything back, give them sleep apnea for the rest of their life. Simple. That's what they used to do. I have a laser, and all you do is you go in with the laser. And I have a different kind of laser for this. You just release it. It takes seconds for a life-changing thing. So, and that's where you revise the lip, and that's where it goes to. But all of a sudden, can you see how this lip is held down? All of a sudden, it flanges up. The seal can be made. The tongue do its job. That child grows completely different for the rest of their life. This is dentistry, and I would say that has avoided them having amalgams and other things because their mouth is going to work the way nature intended. So you can get these seals straight away. There's some exercises you do, and there's some websites. What is interesting is everyone's talking about this MTHFR, the methylation gene that's not right. And many of you heard of that now? Yeah? That will give you midline defects. So if a child has a tongue tie or a lip tie, then you've got to look at those as methylation defects and maybe talk to the parents, because you can then start to talk about their nutritional status or what they can do. More green leafy vegetables, alter their diet a little bit so they're not that gene isn't showing as much. And everything's about genetics at the moment, or epigenetics, isn't it? You've got the gene SNP, how can you modify the life to be slightly different? Equally, when the mother either gives up or we have this busy, stressed life, you put a bottle feed in, and the mechanics are completely different. I think this slide this slide shows it better, because instead of the tongue being to the roof of the mouth, the bottle's here. So what happens is the forces cause the palate to narrow, the teeth come in, so we get crowded arches. The tongue actually widens the lower jaw. You get this sucking in of the cheeks. The muscles are working opposite to the pumping and the growing of breastfeeding. You suck in, put your thumb in and suck, you've got all these forces coming in. And so if you can stop a child from sucking through the bottle and start to breastfeed, you're changing them for the rest of your life. This is the cranial man. This is very, very simply put. As you should have this balanced way, but what you've actually got is you're pushing up, you're narrowing the upper arch, and then you're taking teeth out, reducing the airway, reducing the space of the tongue, causing sleep apnea when they're older. And things like this. We see these, do we treat them? We should be treating them now, because that child has a lifetime of poorer health than if you get rid of that dummy and do some exercises and things. And I can't go through it all in 45 minutes or however many 10 seconds I've got left. Ear problems. All these kids with glue ear, they've got a swallowing problem, a feeding problem. And all the literature is there, but we don't talk to the parents about it. It's easier to put grommets in than it is to actually change their arch, teach them how to suck and do everything properly. We'll skip that one. So, Joe, have you got those little tabs? Joe's going to pass out some little tabs. And what I want you to do is put it on the rougie just behind your upper central incisors, okay? It'll take Joe just a minute or two to come in. What you can do is just get your thumb, dry the saliva, and then stick them on. And I'll come back to this slide in a few moments. The one thing I will say is if you say 2, T, 10, tip, time, tongue goes to the roof of your mouth, just behind the upper incisors. Can you all say that? 2, T, 10, tip, time. But so many people talk with 2, T, 10, tip, time, and you see the tongue not working right. So how many of you concentrate on how the lips, cheek, and tongue do? So we'll come to this as we go through. I'll just carry on with the slides for a few minutes. And we'll come back to that one as well. But please, study both sides of everything, no matter how personally uncomfortable. Because I'm now going to tell you a lot of you guys aren't breathing properly, swallowing properly, and probably not sleeping properly. So don't believe me. Use this as a guide, and please go and read a few things. But this is dentistry, because it's dentists that actually either have the way to solve the problem or make the problem worse. If someone tells you not to study the other side of your beliefs, that is a huge red flag. So a bit like the British Dental Association telling you there's no problems with mercury. And most dentists, because it's more comfortable, will believe what the British Dental Association or what the Italian Dental Association, what the American Dental Association are saying. Instead of believing, that's all I did. I just went and thought, well, let's see the other side of the argument. Okay. Why is this relevant to mercury-free dentists? Why should we bother knowing this? So let's talk about sleep. This is scientific, folks. This is going to blow your mind away, okay? Let's talk more sleep. Why do we sleep? Why do we sleep? So, recover, okay? Recover from what? The chores of the day in the body. Reconsolidate our memories is what they're saying, A lot of people now, I waste my time when I sleep. I'm busy. I only get 6 hours. It's all I need. My symptoms are down to mercury. I sleep too much, but it's the mercury. How many of we hear that? How many of you then use sleep to get rid of mercury from the brain? How does the brain get rid of mercury? Do you really believe that glutathione molecule goes in, binds to the mercury, whatever it does, and then pleasantly walks it out the brain? It's a bit like people taking chlorella and thinking it goes to their fingertip, picks up the mercury, and then takes it out the body just like that. Now, OSR might actually do that. But how do you get the mercury out the brain?
Shrinking the brain.
You shrink the brain. How do you shrink the brain?
When you're asleep.
When you're asleep. Now, the brain doesn't have lymphatics. We have lymphatics throughout the rest of the body. What drives the lymphatics? Breathing. Okay, we'll come to that. But what happens when you're asleep? And this has only been found out in the past 4 years now. Okay? This is all brand new stuff. Sleep drives metabolic clearance from the adult brain. Okay? I'm not going to go too heavy on it. The purpose of sleep brain is a mystery. They found that metabolic waste products of the neural activity were cleared out when the sleeping brain at a faster rate than during awake. This suggests a mechanistic explanation of how sleep serves as restorative. Okay? So when you're asleep, the brain gets rid of it. If I'm thinking like mad now, all my spaces between my neurons because my neurons are thinking and working, they're all expanded. I'm producing waste at this moment in time. When's that going to go? So the research basically said sleep across all species is a vital function. It's the one thing, along with breathing, that everyone needs. And here they're talking about they're getting rid of beta amyloid during sleep. Well, we've heard of beta amyloid from Boyd, from so many other people. So how does the brain get rid of beta amyloid? We create it by putting mercury in. How does it get rid of it? So maybe we get rid of these neurotoxic waste when we're asleep. Loads and loads of words. But basically, they get rid of 65% of the waste when you're asleep. And you need good, long quality sleep. There's all this thing called the lymphatic system. And it was interesting, you were saying before that dentists have higher incidence of glioblastomas. I lost an associate to a glioblastoma because you have all these glial cells, they're not working, so they're absorbing on the mercury, and that's why dentists get more brain cancers. Has everyone got one of those tags? Has everyone got a tag in their mouth?
Yeah.
Bobby needs one. So here's the slide. And basically they put 2 cannulas in a mouse's brain, and then they saw how much came out how much fluid was flowing through the brain. And the person who's talking tomorrow about cranial osteopathy will talk about the skull moving, the bend and the tensions in the skull. But what we always used to thought was the body produced cerebrospinal fluid that then flushed the toxins clean. What we're now finding is that cerebrospinal fluid flows 2-3 times faster once you're asleep. So that is why sleep is so important. Right, have we all got those little things stuck to the roof of your mouth? Okay? Just a simple thing. If I talk you through it first and then you do it, this is just a bit to wake you up. First of all, that's where your tongue should be living at all times. And we're going to add more to this as we go through. So that should stay stuck on your mouth for about an hour or so. But if I'll talk it and then do it. You put your tongue to the roof of your mouth, bite your teeth together, lips apart and swallow. That's an ideal swallow. A lot of people will struggle with that because a lot of people will swallow with the tongue between the teeth, or the tongue going forwards. And immediately you're not pumping your cranial system, you're not doing all the cranial stuff. But until I come to the next bit, that's where your tongue should be. And that is what an adult swallow should be like. You should be swallowing twice a minute when you're awake, once a minute when you're asleep. And that's pumping everything, making everything good. It also means when you say 2T, 10-tip time, lip, loop, blab, lady, line, that's where the tongue should be going to make the sounds. Now it's interesting, different cultures have different shaped faces because of how you make sounds. And it is put forwards that the Japanese and the Oriental people have more crowding in their mouths now because they're learning English and the tongue is working around the mouth differently, as well as eating different foods. So there's lots of thoughts and research going on out there. So just keep your tongue there. See how many of you are actually going to be tongue to the roof of your mouth, lips slightly together and breathing through your nose. I'm going to make it more difficult for you as more of you fall asleep. And basically all this slide is saying is when you're awake, you get very little of this cerebral spinal fluid, but when you're asleep, you get rid of the beta amyloid, but you also, what they did was they anesthetized them. They gave the mice ketamine, put them to sleep, and anything that makes you unconscious, all of a sudden you clear all the toxins out. Well, there's some other slides. So here we go. So they're getting rid of beta amyloid when they're awake, but they get a lot more of it when they're either got ketamine or asleep, magnitude of almost double, but also clearing inulin and other toxins that are in the body. Now I'm not saying, as yet they've said mercury comes out the body, but if mercury is in the brain because we've got a leaky blood-brain barrier, because we've got a leaky gut, how far do we go with healing someone? Probiotics every single time. If you've then got a leaky blood-brain, at least you can get rid of the mercury. If the person has a good night's sleep, the brain shrinks by up to 50%, perhaps 60%, all these fluid channels open, and everything flushes out. And that's what happens in the brain. So, next time you've got someone saying, I want to detox the mercury and I've got brain fog and all of these things, the first thing you do is you don't give them chlorella or, liposomal vitamin C or all these things. You ask them, how well do you sleep? How often do you sleep? How many hours do you sleep? And what can I do to get your sleep better? Because then anything you give them is going to work better. Does that make sense? Okay. So who uses sleep as part of their detox? Who looks at their patient's mouths to see if they can breathe well at night? Who asks how many hours of quality sleep do they get? I'm not going to ask. How many females do you know get up in the middle of the night 2 or 3 times a night and have a wee? You have a sleep problem. How many men have high blood pressure? You have a sleep problem. Simple as that. Ask, and because I'm doing a lot more sleep stuff, I ask, did you get up 2 or 3? Oh, I get up 2, 3, 4 times in the middle of the night and have a wee. So every 2 hours, they're not getting restful sleep. They're not getting all the other things, your alpha waves, your theta waves, and all of that. But why? Because dentistry has knackered up their mouths and allowed them not to breathe properly. Is a speculation. Don't believe everything I say. The thing is it just at night? So we have all this sleep disordered breathing. You're asleep, therefore you don't breathe well. But what we're actually saying is, that means you breathe perfectly well during the day, but you don't breathe well at night. That's a bit of an oxymoron. That just doesn't suit. So has dentistry, which is the first part of the lecture, caused the problems so they cannot breathe during the day? It makes them ill, and therefore it's perpetuated at night when they're asleep. If you've taken out, 4 teeth, made the mouth 20% smaller, they lie on the back, there's only one place for the tongue to go, and that's back. I'm not going to give you all the solutions today. I'm just challenging you. This is the kind of dentistry we could or should be doing. And equally, we've had lectures from guys in IAOMT in America. Can dentistry retreat the mistakes? And now in America they put braces in to open up all the extraction spaces, to create the space so someone can breathe. And you're going to have so many knock-on effects from helping someone breathe. Right, it's time to get up and move, okay? This is us partying in Liverpool, because is sitting the new smoking? You've now been sat for, I've only been lecturing 10 minutes. Can you all just stand up ever so quickly and just shake things around? Is sitting the new smoking? A modern sedentary lifestyle. So if I just said, right, stand up and have a cigarette, how many of you do that? Shabir. Okay. Stupid question, yeah. But, you're all sat there. We should be moving around. And scientists don't take sitting down. Watching TV and generally sitting on your butt all day is taking years off your life. So we should all be moving. So if you want to move around, Mark, I applaud you. I do exactly the same. I stand, I walk around. I can't stand sitting 3rd row back, right in the middle. Just can't do it. Maybe because I smell a lot, I don't know. So, the prime function of your brain, sorry, I thought I got rid of all the animations, your mind and your body, is to take the next breath. Because without that, nothing else matters. It doesn't matter what we're going to have for tea tonight or how many gallons of beer we're going to drink. If you don't take your next breath, you're not doing any of them. Everything else is secondary. Okay? In your life, you'll only ever catch one of 4 things. A virus, a bacteria, a parasite, or a fungus. You're not going to catch high blood pressure, crooked teeth, a stiff neck, or cancer. But we talk about them in the same way, don't we? And yet those are acquired because we think, they're endemic, but we don't. It's a great slide, that one. It's not my slide, but it's a great slide. So, second only to heartbeat, we breathe more times. You can sit down whenever you want, but you know what? You'll actually be better standing up. We breathe more times than any other function of the body. The average person, 30,000 breaths a day. Now, the next ones are quite interesting. We all overbreathe, and I'm going to show you the figures of that in a minute. So, if we ate for 3 people or drank for 3 people, we would become sick. I tried. My body's an experiment to that. And we're going to try again tonight, aren't we, Mark? So, breathing for 3 people is just as harmful, but we just don't see it. So if that over-breathing is causing high blood pressure, irritability, and all the things I'm going to illustrate, because how many of us are over-breathing? How many of you know what the normal breathing rate is? How often should we be breathing? Certainly if you sat down without a cigarette in your mouth. Actually, he has a theory that he's smoking to get his carbon dioxide levels up.
No, to get rid of the mercury.
No, to get rid of the he's too many free antioxidants. So, less than 10% of the people breathe efficiently or effectively. Because we're all sat down as dentists, we're all working. Quite a few of you are sitting here with your mouth open, breathing through your mouth. That's not the way your body is designed to do. So guess what? Is it possible to retrain a person's breathing and return it to normal function? So, Joe's now going to go round with some micropore. I was going to use masking tape. It looked a bit too criminal. And you're going to tape your lips together. So now you've got something stuck to the roof of your mouth, which is where your tongue should live, and we're going to tape your lips together. See how long you can all breathe just through your nose, because that is how you should all be breathing. That's how all your patients should be breathing, and I want to demonstrate to you that breathing properly is going to give you healthier patients. And if you're doing a detox protocol with them, right, okay, I know I'm running over time, just a few minutes, like 100. Right. So, okay, so that's true. So, that's extreme breathing through your nose. Look at this guy. Turn around, Paul. Show everyone. I see how long you can breathe through your nose. How many of you get your patients to take their mouth together when they're asleep? That's how you should do. We should all be sleeping with our lips together and breathing through our nose. Now, don't be embarrassed. We're not looking at you if you take it off. But, you know, you'll get symptoms of panic attacks and stuff like this. These are people over-breathing. What's a panic attack? You're not breathing properly. Sorry, I'm going to skip through these slides if I could. Mathematically, if you have fewer breaths, you'll live longer. And the information was, in the 1920s and the 1930s, they reckon 6 to 7 breaths a minute was average. Now we think 12 to 15 breaths a minute is average. And that's only because when I was at Campbell University, cholesterol of 5 or 200 in American money was good. Now they want your cholesterol down to 160 or 4 or even lower. So as we get a sicker population, you actually change the ideal numbers. We should all be breathing 6 to 8 times a minute, and you should be training yourself how to do it. I'll tell you what, if I could take a picture of all you guys now, this is the weirdest lecture I've ever given. So, let's get through these. We've doubled the amount that we're breathing, like we're halving the amount of cholesterol we should have in our blood. But equally, in this period of time, for all the ages, we're seeing an increase in all the chronic diseases, certainly in older people. How's increasing in all the chronic diseases caused, is it caused by the fact that none of us are breathing properly? It's a hypothesis, okay? And it's going to get worse as we go older. Come on, let's get into the good slides. Right. Compromise causes compensation. Compensation causes a parafunction. Parafunction causes dysfunction. Dysfunction becomes the new normal. The new normal perpetuates compensation. When none of us are functioning as human beings, go back to sleep again. We have electric light bulbs now. We don't go to sleep when it goes dark. We don't get up when during the day. We've already compensated the fact we don't get enough sleep. Right. Carbon dioxide. I might not get through all of them, but carbon dioxide is vital to life. No organism can live without carbon dioxide. And we always think it's oxygen. Carbon dioxide is a buffer, carbon dioxide is an antioxidant. You've seen that slide. Different kinds of carbon dioxide. The role of cognitive, the functions, it is involved in the nervous system, hormonal, digestive, everything. So it is vital to every part of our system. And therefore it improves if you get breathing right. The big thing with carbon dioxide is how many of these things do we see in mercury? Irritability, sleeplessness, stress, anxiety, allergic reactions. I'm afraid you can get a mercury questionnaire and you could superimpose it with breathing. So maybe as good biological dentists, you teach them how to breathe as well as they take their mercury fillings out. You actually will probably get better results. I'm about 6 months into doing all of this with my practice. I'm going to skip all of these, but it affects all of those systems. So, I like this saying. Yeah, because everyone says, what a load of rubbish. Well, until you go away and read about it, or get these slides and pursue it, then you're going to do something more. So, breathing made simple. The human body can go 5 weeks without food. It should say food. Go 5 days without water. And go 5 minutes without air. Okay? So why are we worried about the food we eat? Or the water we drink? And yet we don't breathe properly. And we overbreathe. I'm going to try and show you this. If you overbreathe, you reduce the oxygen in your brain by 40%. So when people overbreathe and have panic attacks, all of a sudden, what do? Is to say, breathe slowly, breathe calm, and the brain comes back again. Anxiety is about 50 to 60% of non-emergency hospital admissions because they're overbreathing. The brain starts feeling lightheaded. I've had a hygienist today who's taken out the wrong tooth, overbreathed and fainted on me. Well, she didn't faint on me, she fainted on the staff. But we all overbreathe. So breathe, as this perfect man says, a perfect breath is a man. Right, please all sit down. You're all stood up. Right, actually, this is a very important slide. Because again, we had everyone talking about breathing and alkalizing their diet. You can alkalize yourself quicker by breathing properly than you can actually by eating food. And if you're breathing incorrectly, you're never going to get the success. And how many of your patients come in saying, you know what, I'm eating all these green leafy vegetables, I'm only eating this, that and the other, and I'm not feeling any better. If they're overbreathing, they're not going to get their pH right. And so, we're going to have to miss a few slides. I do apologise. But this is only about the importance of breathing. And we're going to say, I think the big thing is, what I'd like you all to go away and look at buteyko breathing, because we spend 66% of our time awake and having bad lifestyles, and we only spend 33% in bed. So it's not about how you're spending your night breathing. No, I've just shown you, if you don't breathe well at night, you're going to have, you're not going to get rid of all the toxins from your brain, and I would suggest a lack of sleep is what's causing our current epidemic of dementia and stuff like that. Because we've pushed ourselves too hard, the brain hasn't got rid of all the toxins, we've poisoned our neurons, and therefore we've got this massive number of dementia occurring. Right? We spend 2/3 of our time in bed, not always asleep, and yet we think about breathing. But it's breathing during the day that's the big thing. So hopefully I'll explain some of this simply, the rest of the slides. And please, a year from now, I really hope you said, God, I heard what John said, and you know what? I just had a tapered micropore by the side of my bed, and I went to bed and stuck my bed together. I got some of these things, and when I'm driving the car, I just stuck it to the roof of my mouth, and I started breathing. And then when I was having my patients, and they're all coming in, how many of you want a mercury toxic patient walking in like this? Yeah? None of us do. How many of you want someone coming in saying, hi, I've been reading and I just want a few amalgams taken out. You want to treat those every day because they're going to be your success cases. So let's change their sleeping, change their breathing to get healthier patients. So this is this leap of faith, isn't it, hey? How many of us are here? And this isn't late blood. It's not a big leap what we want to be. So please, can we make the jump? There you go. That's me, no. And trust me, you can dance. Just do it. And the answer is why not? And all I want on my tombstone is John Roberts. Why not? Thank you very much. Any other questions can be asked in the bar tonight? Okay, coffee time. I'm sorry I've taken some of your time. I've robbed you of 10 minutes of your life you won't get back, but hopefully it was okay. Okay.